Welcome to Nursing Competitors. Question number 7. When teaching a mother of a 4-month-old with diarrhea about the importance of preventing dehydration, the nurse would inform the mother about the importance of feeding her child. Option A, fruit juices. Option B, diluted carbonated drinks. Option C, soya-based lactose-free formula. Option D, regular formulas mixed with electrolyte solutions. Answer, soya-based lactose-free formula. Rationale. Diluted fruit juices are not recommended for rehydration because they tend to aggravate the diarrhea. They are act as hypertonic property. Diluted soya drinks have a high carbonate content which aggravate the diarrhea. Soya-based lactose-free formula reduce the stool output and duration of diarrhea in most infants. Regular formulas contains lactose which can increase diarrhea. Question number 8. Prior to administration of antibiotic, there is need to sensitive test. Which of following antibiotic is not required sensitive test? A. Metronidazole. B. Merophenium. C. Ceftriaxone. D. Amoxicillin. Answer is metronidazole. Question number 9. Client with a cervical spine fracture at clavicle has just arrived in the emergency room. The primary nursing intervention would be A. Stabilization of the cervical spine. Option B. Airway assessment and stabilization. Option C. Confirmation of spinal cord injury. Option D. Normalization of intravascular volume of all. Answer is airway assessment. Rationale. Primary intervention is protection of the airway and adequate ventilation. First priority action. If cervical spine injury is suspected, the airway should be maintained using the Jatras method that also protects the cervical spine. All other interventions are secondary to adequate ventilation. Question number 10. A client is being discharged with albuterol and beclomethasone dipropionate to be administered via inhalation 3 times a day and at bedtime. Client teaching regarding the sequential order in which the drugs should be administered includes Option A. Glucocorticoids followed by the bronchodilators. Option B. Bronchodilators followed by the glucocorticoids. Option C. Alternative successive administrations. Option D. According to the patient preference. Answer is bronchodilator followed by the glucocorticoids. Rationale. Bronchodilators albuterol can dilate the airway first, allowed to the glucocorticoids. Beclomethasone to be inhaled through open airway and increase the penetration of the steroid for maximum effectiveness of the drug. Next, coming to the question. 11th question. A client with a diagnosis of C4 injury has been stabilized and is ready for discharge because this client is at risk for autonomic dysreflexia. He and his family should be instructed to assess for and report about option A. Dizziness and tachypnea. Option B. Circummolar pallor and lightheadedness. C. Headache and facial flushing. Option D. Pallor and itching of the face and neck. Answer is headache and facial flushing. Next, coming to the question, 12th question. Which of the following is an indication of phototherapy in newborn with hyperbilirubinemia? A. Bilirubin level 12.5 mg for dl. B. Bilirubin level 50 mg for dl. C. Bilirubin level 20 mg for dl. D. Bilirubin level 22 mg for dl. Answer A. Bilirubin. Answer A. Bilirubin level 50 mg for dl. Indication of phototherapy. In term newborn, more than 50 mg for dl serum bilirubin level. In preterm newborn, more than 5 mg for dl serum bilirubin level to prevent need to blood transfusion. Phototherapy should be discontinued more than 10 mg for dl 2 times. 13 question number A. 35 question. 35 weeks pregnant client is undergoing a non-stress test NST. During the 20-minute examination, the nurse notes 3 fetal movements accompanied by the acceleration of the fetal heart rate, each 15 beats per minute, lasting for 15 seconds. A nurse intervenes with test to be non-reactive, B. Reactive. Answer C. Positive, D. Negative. Answer is reactive. Result determines the non-stress test. Reactive NST. Presence of 2 or more fetal heart rate, acceleration within 20 minutes of period. Next, reactive. Reactive NST. Presence of 2 or more fetal heart rate, acceleration within a 20 minutes of period. Each acceleration must increase the heart rate 15 beats per minute above the baseline rate and last for at least 15 seconds when the fetus is about 32 weeks gestation, or 10 beats per minute over 10 seconds when the fetus is at or below 32 weeks of gestation. It indicates healthy. Non-reactive NST. Fewer than 2 adequate acceleration during the prolonged period, which may be over an hour. It indicates fetal distress or abnormal result, in which no acceleration noted in FHR. NST test can be performed after 32 weeks of gestation. During NST test, the client is placed lateral or side-lying position to avoid supine vena cava syndrome. 14th question. Which of the following electrolytes should monitor in a patient with congestive heart failure receiving a decoction and furosemide? Option A. Sodium. Option B. Calcium. Option C. Potassium. Option D. Zinc. Answer is zinc. Answer is zinc. 15th question. During CPR, the risker should change their position. A. Every 3 minutes or after 2 cycles of CPR. B. Every 2 minutes or 5 cycles of CPR. C. Every 5 minutes or 2 cycles of CPR. D. Every 1 minute or 2 cycles of CPR. Answer is every 2 minutes or 5 cycles of CPR. 16th question number. The chest compression and ventilation ratio should maintain neonatal resuscitation. A. 3:1 ratio of 90 chest compression and ventilation every 30 seconds. Option B. 1:1 ratio of 90 chest compression and ventilation every 90 seconds. C. 3:1 ratio of chest compression and ventilation every 20 seconds. Option D. 2:1 ratio of chest compression. Option 17. Intramuscular injection in neonatal should be given in A. Dorsogluteal muscle. Option B. Vastus latalis muscle. Option C. Gluteal maximum muscle. Answer is vastus lateralis muscle. Next, 18th question. What is the normal plasma osmolality range in adult? A. 260 to 270 milliosmol per liter. Option B. 280 to 290 milliosmol per liter. C. 320 to 330 milliosmol per liter. Option D. 300-310 milliosmol per liter. Answer is 280 to 290 milliosmol per liter. 19th question. Which of the following clinical features would be seen in client with dengue hemorrhagic fever except A. Thrombocytopenia, B. leukocytosis, C. lymphadenopathy, D. fever. Answer is leukocytosis. Leukocytosis. Question number 20. A pediatric patient would receive 500 ml DNS through the burette infusion set in 5 hours. Calculation the correct fluid drops per minute. A. 100 microdrops per minute. B. 100 microdrops per minute. C. 80 microdrops per minute. D. 80 microdrops per minute. Answer is 100 microdrops per minute. 21 question. Which of the following ECG finding would be seen in a patient with kidney failure with potassium level 6.3 mg for dl? A. Flattened T wave. B. Peaked T wave. C. ST segment elevation. D. ST segment depression. Answer is peaked T wave. Rational. ECG changes in hyperkalemia. Hyperkalemia, tall peaked T wave, flattened P wave, prolonged PR interval and wide QRS complex. ECG changes in hypokalemia, peaked P wave, prominent U wave, T wave inversion or shallow and ST depression. Next, coming to the question. 22 question. In 8-year-old child comes to the physician office complaining of swelling and pain in the knees. His mother says the swelling occurred for no reason and it keeps getting worse. Its initial diagnosis is Lyme disease. When talking to the mother and child, question related to the which of the following would be important to include in the initial history? Option A decreased urinary output and flank pain. Option B, a fever of over 103 degree Fahrenheit occurring over the last 2 to 3 weeks. Rashes covering the palms of the hands and soles of the feet. D. Headache and malaise or sore throat. Answer is rashes covering the palms of the hands and soles of the feet. Rational. Lyme disease is a tick-borne illness caused by the bacterium Borium burgdorferi. It is transmitted to humans through the bites of infected black-legged ticks. Typical symptoms include fever, headache, fatigue, malaise, joint pain, weakness in lower limbs, and a characteristic skin rashes called erythema, migraines, which often occur in bull's eye pattern. Thanks for watching. Like and subscribe more videos. Thank you.